We don't exactly live around the corner. There are citizens of the tribe who do not have transportation. So I can see how living in the area that we live in would most definitely impact access to care. My name is Melanie Stewart. Most people call me Mel. I am 62 years old. I am a citizen of the Chickahominy tribe. My breast cancer diagnosis was revealed by an annual mammogram. I just remember Dr. Ivy telling me, it's very small, we have caught it early, and she said a ton of other things that I just couldn't comprehend. It kind of reminded me of the Charlie Brown cartoon and the wah, wah, wah. That's exactly how I felt. I was just in total shock when I got the results, and I was told that it was cancer. I went in and I had a lumpectomy, and then following the lumpectomy, after I had time to heal, I had radiation, and it was in the form of brachytherapy. It's a much shorter treatment. I was able to complete in 3 days. I wanted to go that route because I wanted to continue to work while I was in treatment. I believe it's because of the relationship with Massey Cancer Center with the Chickahominy tribe that I was able to receive the care that I did.
Massey Cancer was coming out to the Chickahominy Tribal Center to discuss a potential project to look into the instances of cancer that we have in our tribal community. So the very first day that Massey came happened to be the same week that my mom was scheduled for surgery. And I mentioned my mom's diagnosis, and at that first meeting, Dr. Wynn said, let me know if you need anything at all.
From there, we were just able to make all of the contacts that I needed to get my care going. I have a vast history of cancer in my family. My grandmother died from leukemia. My grandfather died from colon cancer. There was brain cancer, pancreatic cancer, lung cancer. It's a huge, huge amount of cancer in the family. I was diagnosed with my second breast cancer a little less than a year later. I was flabbergasted. I'm like, not again. How can this be happening again? So went through treatment, and I was able to have the brachytherapy again. I was a little worried because not that much time had passed since I'd had my first round, and I was like, am I even eligible to go through brachytherapy again? But thankfully I was. But it was basically the same. I had the lumpectomy, and what was different this time was I had to have chemotherapy, and that I was devastated. But it was part of the treatment. My very first infusion, I had an allergic reaction, like an anaphylactic reaction. I had to go to the emergency room. I was also doing Herceptin at the time, and my oncologist said, we'll keep you on the Herceptin. I feel like that would be the most beneficial for you. So I continued with the Herceptin once every 3 weeks, and I was able to complete that in March of 2024. I get a mammogram every 6 months and a breast MRI every 6 months. I don't want to live in fear, but sometimes I can't help it. What if I'm doing all of this and it still comes back? I do think about that.
Cancer is not a wonderful experience, but having Massey care about our community, I think that has helped to make folks want to get the care.
Within the Chickahominy tribe, there are many programs that have opened up within the past few years. Like, for instance, there are nurse visits. The tribe also has a transportation program, and they have health fairs. Making research a national priority for cancer is extremely important. For some people, like research, clinical trials, that might be the only option that they have. Please do not stop the funding. Please do not stop the research. It is vital. Everyone deserves health care. It doesn't matter your socioeconomic status. Give everyone a chance.